Once I make a diagnosis of Parkinson's disease, probably the most frequently asked question is, what causes Parkinson's disease? Why am I afflicted with this condition? And it's not an easy question to answer because we really don't know yet what causes Parkinson. We suspect there are many different causes, while the vast majority of patients with Parkinson probably do not have anyone in the family with the condition. That doesn't necessarily mean that Parkinson's disease is not genetic in that individual. In fact, there is more and more evidence to suggest that many causes of Parkinson's disease are of genetic origin, even though we don't necessarily know what specific gene or genes cause the disease in that particular individual. So there's growing evidence that some individuals are genetically predisposed to develop Parkinson's disease. In some of these individuals, we can actually test for the specific gene mutation. For example, there are tests for Parkin mutation, which is one of the most common causes of young onset Parkinson. And there are other genetic tests for specific forms of Parkinson's disease, such as LRRK2 mutation, which is probably the most common cause of adult onset, typical form of Parkinson's disease. But in many cases, we don't find a specific cause. One of the first questions we want to address when we make a diagnosis of Parkinson's disease is, does this individual really have Parkinson's disease, or could he or she have some other Parkinsonian disorder? For example, there are many drugs that people take that can cause Parkinson's symptoms. One class of drugs are the drugs that are used to treat various psychiatric conditions, so-called antipsychotic drugs. And these drugs block dopamine receptors and as such can cause Parkinson's symptoms. There's a drug called metoclopramide, which is a drug that is often used for nausea and for some other gastrointestinal problems, and that is one of the more common causes of secondary Parkinsonism. It's Parkinsonism that can be due to identifiable condition, in this case, drugs. There are certain street drugs that can cause Parkinsonism. A classic example is the drug MPTP, which was found to be a cause of Parkinsonism in young drug addicts in the San Francisco Bay Area. That is not a common cause of Parkinsonism, but at least it illustrates that in some cases, Parkinsonism can be due to an identifiable cause. Rarely do we see patients with Parkinsonism who have, for example, brain tumor or some other structural lesion in the brain, and that is often suggested by abnormal examination that shows not just Parkinson symptoms, but, for example, weakness on one side of the body, or speech problems, or some other symptoms that would make the neurologist think that the patient has something other than Parkinson's disease. There's a class of diseases in which Parkinsonism can be one of the symptoms. And by Parkinsonism, I mean symptoms that are typically seen in Parkinson's disease, such as slowness of movement, tremor, stiffness of muscles, difficulty with gait, shuffling gait, partial instability. This is called Parkinsonism. The most common cause of Parkinsonism, of course, is Parkinson's disease. But there's a class of diseases in which Parkinsonism is just one component, and these individuals may have other symptoms besides Parkinsonism, and they are referred to as Parkinsonism plus disorders. The most common in this class of diseases is progressive supranuclear palsy. In this condition, in addition to the typical Parkinsonian features, the patients may have difficulties with their eyes, looking up and down, for example, or they have postural instability or loss of balance early on in the course of the disease. These patients usually do not have a typical rest tremor that is so characteristic in patients with Parkinson's disease. And they don't respond to the classic medications that are used for Parkinson's disease, such as levodopa. Another cause of Parkinsonism that is not due to Parkinson's disease, the so-called Parkinsonism plus disorders, is multiple system atrophy. This is a condition that may look initially like Parkinson's disease, but these patients usually complain of autonomic symptoms. What we mean by autonomic symptoms are symptoms such as low blood pressure, so they complain of lightheadedness when they stand up, or they may have urinary or sexual or gastrointestinal problems, including constipation or sexual dysfunction or incontinence. These are indications that the patient suffers from autonomic dysfunction, and when this is combined with Parkinsonism, then we refer to this disorder as multiple system atrophy. So these are just examples of causes of Parkinsonism, not necessarily Parkinson's disease. But within Parkinson's disease, we think that the cause of the loss of nerve cells in the substantia nigra, in the part of the brain that produces dopamine, is due to complex interaction between genetic factors on one end of the spectrum and environmental factors on the other end of the spectrum. And we still have a lot to learn about how this complex interaction actually results in cell death and eventual loss of dopamine, which is the biochemical hallmark in the brains of patients with Parkinson's disease.